Hi, I am so happy to see you in this program of JIP Hassan and Hot News. Yesterday we received two pneumonia patients, age group somewhere around between 6 to 8 years. So the child presents with cough for past 1 week and intermittent fever, and the child had lung crepitations suggesting possible pneumonia, which was in turn further confirmed with chest x-ray. So any pneumonia we have to differentiate whether it is a community acute pneumonia or hospital acute pneumonia. Since this child comes from community directly, so we are dealing with community acute pneumonia. Hospital acute pneumonia means development of pneumonia 48 to 72 hours after the hospital admission. So why we have to differentiate? Because community acute pneumonia is mostly caused by Streptococcus pneumonia, which is generally amenable to beta-lactam antibiotic, whereas if you diagnose somebody to have hospital acute pneumonia, generally which involves Pseudomonas and E. coli, which warrants broad spectrum antibiotic. So since it is a community acute pneumonia, the child has been started with beta-lactam antibiotic. We have to cover atypical bacteria as well. What do you mean by atypical bacteria? So atypical bacteria are Legionella pneumonia, Mycoplasma pneumonia, and Chlamydia pneumonia and Chlamydia psittaci. The characteristic of atypical bacteria are they won't respond to beta-lactam antibiotic like cephalosporin or penicillin, even carbapenems and so on. So they will respond only to macrolides like azithromycin and or doxycycline. So this is very characteristic of atypical bacteria, and they can't be detected by simple gram stain. They can't be detected by any other traditional culture methods. So that's why it is called as atypical bacteria. So any diagnosis of community acute pneumonia requires introduction of beta-lactam antibiotics with either azithromycin or doxycycline to be introduced. Then we received yesterday one case with altered sensorium. So generally any patient's altered sensorium, I used to divide in such a way that the causes above the neck, I mean within the brain and below the neck. So initially, unless patient has gross neurological deficit, I won't go for imaging very immediately. So the below the cause, below the neck, okay, usually I will search. The below the neck generally simple metabolic disorder including hypoglycemia, hyperglycemia, hyponatremia, hypernatremia, these can be easily looked. In this patient we found out sodium is 122. So we infused 3% sodium chloride, which has greater osmolality. So easily it can correct sodium deficit. So this patient is greatly improved. After administration of 3% sodium chloride 10 ml per hour, her sodium has got attained 128, which made her wake up. Now she is doing well. So we are evaluating the causes for hyponatremia. So the most important, the first step in evaluation of hyponatremia, you have to do serum osmolality. Naturally serum osmolality is simply determined by serum sodium. When you have low sodium, you are expecting low serum osmolality. When you have high serum, your osmolality will be very high. So serum osmolality is nothing but serum ion concentration. So 90% of your serum ion concentration or plasma osmolality is contributed by serum sodium concentration. So naturally when serum sodium goes down, your plasma osmolality will be low. So we checked serum osmolality. Her serum osmolality is 265 against a normal value of around 290. Why you have to check for serum osmolality? You already told when sodium comes down, naturally serum osmolality also comes down. Then why you should check? Yes, there are few conditions where sodium level may be low, but your serum osmolality may be normal or high. The classical example would be hyperlipidemia, hyperproteinemia, hyperglycemia, mannitol administration, where patient serum osmolality won't go down So these causes of pseudo hyponatremia to be ruled out. When serum osmolality is low in the presence of hyponatremia, we definitely say that we are dealing with true hyponatremia. So we evaluated, so we almost diagnosed what is the cause for hyponatremia. We will see in the subsequent video session. Thank you.